if we look at the feedback for the exam from RACGP, there's a couple of topics that they say again and again come up, and they're easy ways to lose marks and easy ways to try and string together some marks if you can. Of course, one of the most important things is try and avoid just repeating information that's already given in the question stem. That's information that's kind of a given, so try not to just feed that back. Try and specify unique management actions if existing measures are already mentioned in the stem. Again, a bit of a duplication there, but it's about avoiding repeating things that are already done. Tailor your answers to the specific question being asked to maximize those marks. So really try and read the question, work out how does this apply to that specific patient in the stem. And of course, try and avoid using the same response across multiple questions in the same case. Now, there's going to be times where you feel like the same answer could fit in multiple sections. And if that's the case, go back and have a look. Where does this answer really sit? Where is the most appropriate spot for it? And that then gives you the opportunity to have an extra free answer slot free for one of the questions that you can fill in with something else. It's about diversifying your answer spread. Now, if you are lost and you're not sure where to go, try and have a few fallback approaches to take that will get you out of jail. So some of the kind of structured approaches to take for this, for our diagnosis questions, try and break things down into that acute, subacute, and chronic class of management. If you can try and think of one or two things that would fall into each of these categories, you're probably going to be able to wrangle some marks out from there. And likewise for management questions, particularly for sticking for acute questions we've mentioned in here before, really try and take that DRS ABCDE framework. Of course, that's checking for dangers, checking for response, sending for help, airway, breathing, circulation, disability, and exposure. Always, always, always expose the patient. If you don't look, you don't find. Of course, then some of those extra ones that kind of get forgotten, the F and G that often fall off there. If it's a surgical patient, you can always specify something like fast the patient. It's one of those little things that seems like silly. Of course you would do that. It could be free marks in the exam. And of course, don't ever forget the glucose. We have it drilled into us time and time again, but it's something that's easy to forget because, again, it's one of those things you just presume it gets done along the way. Slipping across to our chronic management then, the vitamins A, B, C, D, E framework is a fantastic way to kind of fall back there. For chronic management, look at our pharmacological options, which, don't forget, not only includes medications, but also our immunisations. So it's an easy one to kind of sneak a few immunisations in if they're asking for those pharmacological chronic disease management options. For our non-pharma stuff, this is where SNAP stuff comes into play, so make sure you are very familiar with the SNAP framework. Read up the RACGP website summary on SNAP. It is brilliant, and you will be surprised how many times content from that page manages to find its way in the exam. Have a think through all of your allied health referrals. Think of all the different allied health specialties that you could be involving here, whether it's physiotherapy, occupational therapy, speech pathology, dietitians, you name it, they're all fair game. And of course, our other support services as well. So we may have things like allied health assistants or liaison officers that you can engage with to meet that specific patient's needs. Now, if you haven't heard of vitamins A, B, C, D, E before, it is a really good kind of catch-all. Everything will fall into some category. And so if you're drawing blanks on what to put, this is a good little way to kind of think through, okay, are we covering this aspect of medicine? So vascular, infective, trauma, autoimmune, metabolic, idiopathic, sometimes it's us, neoplasia, social, alcohol or substances, behavioural, sometimes it's them, congenital, degenerative, sometimes it's time, and of course endocrine. Everybody hates endocrine. Another fallback kind of thing for just kind of broader overall management of patients, taking that kind of holistic approach, is the biopsychosocial legal. Never forget the legal aspect as well. And sadly, it's becoming a bigger part of our work day to day. So the biological is to assess those anatomical, physiological processes and where we can potentially intervene. Psychological is looking into our mental health aspects. Don't forget to integrate different screening tools. If you're aware of some that might be specific to that case, throw them in, as well as considering specialist referrals as appropriate. Social is looking at things like income support, considering those Centrelink referrals as well as Centrelink certificates or medical certificates. As well as just practical assistance. If you've got that kind of general good advice, throw it in. And legal, everyone's favourite legal. Legal advice can be from a lawyer, so consider bringing them in. Medical indemnity providers, covering your own backside, as well as patient directives. So things like referring them to police to make statements certainly fall into that bracket there. Now, there's also the 5 A's approach, and this is pretty much guaranteed to be on the exam in some way, shape or form in some question. It's about ask, so identify key issues, advise for clear guidance, assess, so evaluating their readiness for change as well as their capacity, assisting, so offering practical support to implement those changes, and of course the follow-up, arrange, so plan that follow-up or additional interventions as required.